We prepared for you here in Kilifi. Well, medical practitioners at the Malindi Sub-County Hospital in Kilifi have come up with an innovation that seeks to reduce postpartum hemorrhage among women in the communities around this area. The risk of women losing their lives due to excessive bleeding after childbirth continues to be a serious and significant concern for maternal mortality. But the doctors here attest to how this simple low-cost measure technology known as e-motive is a game changer in reducing deaths from child-related bleeding. Have a look. When Gladys was brought to the Malindi Sub-County Hospital 5 days ago after giving birth to her first child at a local dispensary, her life was at risk. She had lost a lot of blood post-delivery.
Iliza vizuri lakini ikaleta shida ya kubleed hata ikanini nikakuja Malindi hapa ni general na ambulance. Shida wakanieleza kuwa ilikuwa ni sijui kizazi changu kilikuwa kiko na growth, ndo ikabidi wakatoa wakanifanyia operation. Ndo akasema kuwa nilipoteza damu mingi, ndo ikabidi wakanitoa.
But it is this new innovation that helped the doctors stabilize and monitor her condition. It's an innovative kind of a drip that is spread on the bed and the patient sleeps on it. It is tied around the patient's waist and allows the blood to flow to a bowl that is marked in milliliters. When the blood surpasses the 300 milliliter mark, the doctors can begin medication. Women who lose more than 500 milliliters of blood within 24 hours after birth are at a great risk of losing their lives.
So for us, what our change has been is that we are still able to diagnose postpartum hemorrhage quite early, and with that we have seen a reduction in the number of mothers who we are having very bad we used to previously have very bad outcomes for. So initially we'd have to struggle with trying to look for blood to transfuse these women. Some needed who had developed acute renal issues had to be dialyzed, and some needed ICU care, and some were lost. So now we've seen a reduction in that. We are transfusing less mothers because now we can quickly manage postpartum hemorrhage in good time. We are not having a lot of morbidity from surgeries that we used to do for these mothers, and we are having less women being dialyzed.
Dr. Maureen Were, the lead obstetrician gynecologist at the Malindi Sub-County Hospital, led a team of nurses to develop the gadget after a pilot project conducted using the technology in 4 African countries, including Nigeria, Tanzania, and South Africa, ended.
We decided instead of waiting until we get the drip, we came up with our own drip to have the continuity in care. Being a high-volume sub-county hospital where we cover this Malindi, Magarini, Tana River, and we also support Lamu, we have roughly 80 to 100 deliveries in a week. And about 6% of those will develop postpartum hemorrhage.
Initially, medical staff and midwives used to estimate blood using their naked eyes. Hence, they could not ascertain the correct estimation of blood a patient lost, and this forced them to administer blood transfusion or take some patients to the ICU. Well, it was too late, and some died of excessive bleeding.
Tumeweka mikakati tayari ya kuwa uzinduzi huu utazunguka katika hospitali zetu zote hapa katika gatuzi la Kilifi ili kuweza kusaidia kina mama wakati wajawazito, wakati wamezaa, kuweza kuwazuia ile complication ya kumwaga damu ambayo inaitwa PPH.
Well, according to the WHO, postpartum hemorrhage affects an estimated 14 million women each year and results in around 70,000 deaths, equivalent to 1 death every 6 minutes.